Senior Biden administration health officials pressured an internal group of medical experts to remove age limit guidelines for transgender surgeries on minors, according to newly revealed court documents. Email excerpts from the World Professional Association of Transgender Health document how Assistant Secretary for Health at the Department of Health and Human Services, Rachel Levine's staff, pressed the organization to drop age requirements for minors to obtain gender transition surgeries in the group's September 2022 Standards of Care update. The documents were revealed as evidence from one of the multiple lawsuits across the country regarding state-level bans on gender transition medical treatments for minors. One excerpt from an unnamed WPATH member recounts a conversation with Levine's chief of staff, Sarah Boatning, in which she said Levine is confident, based on rhetoric she is hearing in D.C., from what we have already seen, that these specific listings of ages under 18 will result in devastating legislation for trans care, asking for the age limits to be removed from the final draft. Several other emails document WPATH's members discussing Levine's suggestions that age limit recommendations be given in a less visible document, and concern that delaying publication of the document was proving a barrier to optimal policy progress. Draft guidelines from WPATH, published in 2021, recommended establishing age minimums of 14 for hormonal treatments, 15 for mastectomies, 16 for breast augmentations and facial reconstruction, and 17 for genital reconstruction and hysterectomy. These were ultimately removed from the final draft. More than 20 states since 2021 have implemented some form of age restriction on gender transition for minors, citing a dearth of long-term evidence for the efficacy of reducing adverse mental health conditions. Most adolescents with gender dysphoria who pursue medical transition are treated with hormonal replacement therapy or puberty blockers, but there have been several high-profile cases of teenagers who underwent surgeries to complete a medical transition and subsequently detransitioned upon reaching adulthood. Many critics of gender transition for minors, including those who have medically transitioned as teenagers, highlight that adolescents have not reached the age of maturity by which to consent to life-altering medical procedures. Critics also highlight that genital surgeries and long-term cross-hormonal therapy can permanently damage future fertility. Levine, a biological male who identifies as a woman, underwent a medical gender transition surgery in 2011 after having been married and fathering 2 children. In 2019, Levine expressed having no regrets about transitioning later in life after having had children. The Supreme Court announced recently that it would take up a challenge by the Biden administration to Tennessee's law that restricts both surgeries and hormonal treatments for minors, marking the first time that the High Court will weigh in on the matter.